At the Roselle Center for Healing, we care about your health and want to help you take your health in a new direction, far from drugs and surgery. Knowledge is the key to optimal wellness and control of your health. We offer free health education on chronic health conditions and natural integrative medicine treatments. Register for free today.
Attend breast thermography and early detection on Wednesday, September 11th at 6 p.m. Space is limited, so register today. Call 703-698-7117 or visit rosellecare.com.
The information provided on Dr. Tom Roselle Live by Dr. Tom Roselle DC, interview guests, show co-hosts, or substitute hosts is not intended or implied to be a substitute for professional medical advice, diagnosis, or treatment. It is for general information purposes only. Information from this broadcast should not replace the appropriate consultation and examination process by a licensed physician. Always consult your own physician prior to changing any current medical directive or prescription.
This is Dr. Tom Roselle Live on 105.9 FM WMAL.
Hi, guys. Welcome to Dr. Tom Roselle Live. Got another great program for you leading into the September 11th in-house program with Derreth Painter, the head of our thermographic imaging department. We're going to be talking about breast cancer but thermographic imaging detection of cancer. Remember what I've been talking about over the last several weeks, that the diagnosis of breast cancer, if not done properly, has a huge error rate. And if you miss it, you're setting up a stage for some major problems. So we want to talk a little bit about the, breast cancer problem as we lead into this thermographic presentation that we're going to be doing this coming Wednesday evening, the 11th. It's important that you understand why thermographic imaging can be so important. And let me start simply by saying this, is that, you're hearing all these terms today like HER2, HER2 breast cancers and triple negative breast cancers and early detection. And, they kind of build on each other, right? And then you better do your breast cancer screening. But what they're talking about is using mammography. And unfortunately, with mammography that is done on a regular basis, it increases your risk, dramatically increases your risk of cancer formation, regardless of, how old you are and so forth. And if you're at that area where you're still producing, if you're still producing estrogens at a significant level, and they're not buffered by something called progesterone, then your risk level goes up. So when do we do that? Well, you can do it at any age, and it's usually over the age of 40 or 50. 50, it seems to be the number today. But what you're dealing with is something that is being triggered by environment. And environment, what I mean is this. We have huge amounts of xenoestrogens. Those are environmental estrogens, not the ones that are produced in your body. And those xenoestrogens can cause cancers both in men and ladies, obviously all of you. So a reason I said men is because, as I said repetitively over several weeks, is that, guys, years ago, it was like unheard of. You were the odd ball for breast cancer. And maybe, less than 1% of the population. Today, depends on the author, anywhere from 3 to 5%. And it has a lot to do with all kinds of things. It has to do with our environmental estrogens. It has to do with the plastics that you're drinking your water out of. It has to do with the estrogens that you get in the water. If you're in a water reclamation area, why is that? Simply because of the fact that if women are put on hormone replacement therapy, for the most part, what happens is they only use a portion of it. The rest of it is urinated in the water. And if you're inside what's called a water reclamation area, so where they take the sewage water and they reprocess it, they can't get a lot of the hormone out. So there's still more there. So when you have a drink of water, you have a cup of coffee, you have some tea, you have a bowl of soup, guess what's still there? It's called estrogen. And you have to find out, are you in an estrogen area? Even the best Walter filters, with the exception of perhaps maybe reverse osmosis, is not going to get it all out. So you have to make sure, that you understand the process of what's really causing it. Why all of a sudden, guys, are you getting more prostate cancers? Now, this is not about you today. We're going to talk about the ladies some more. But I just want you to understand that you also are at risk. So if you go into the literature and you start talking about breast cancer information and an overview of what's really there, they're going to talk about really what the risk levels are, what is prevention. Well, for them, prevention is what? Palpate your breast tissue and go get your mammogram. And that's it. And then they go into, what treatment is available. Then they go into how they're going to reconstruct your breast if you amputate them, and survivorship and so forth. It's crazy, and it doesn't help and prevent anything by going out and amputating your breast tissue, because there's so many different tissues that are sensitive, and you have to be aware of it. But for just sake of looking at what really exists and what things are, there was a, again, you know me with my articles and the things that I read all the time. It's important that you understand some of the terminology that's been put out there. So if you have something called a HER2 receptor positive, and it can go out from there. You can talk about 2L plus HER2 and MBC, and it makes you crazy, right? How many of you really understand every time they put an alphabet soup on something and what it really, really stands for, what it means? I guess to say not too many of us. But when they start treating things, there's all kinds of drugs that have come on the market, and I didn't forget about telling you what that is. I will tell you in just a second. But you start seeing side effects that come a result of tissue destruction, but also the fact that they're going to destroy your tissue as well and cause what they're actually trying to get rid of. There's a drug called Tukysa, Tukysa, and if you walk through the side effects, which are not uncommon to so many other things like diarrhea and hepatotoxicology, that means your liver is getting beat up. Embryo fetal toxicity, that means if you're pregnant on this stuff, you got a problem. And there's potential risk of the fetus. And there's guys out there that are going to tell you to abort if you're within the first couple stages of this, and if you're going to go through this type of treatment. Well, there's other ways, but you need to find out early on. That's why it's so important. It's super critical important for you to understand what is really, really happening and deal with these things on a really knowing what it is that you're making decisions about. And unfortunately, what happens is they scare the hell out of you, and they really never explain how the body works. You want me to give you my opinion of why that occurs sometimes? Why they don't get into the depth, because they can't take these big terms and break them down into palatable, understandable pieces that you actually might be able to understand. Yeah, I said that. Do they do it on purpose? Sometimes I think the way they treat pregnancy or cancers, didn't mean the last one, cancers, is simply by scaring the hell out of you and getting you to say, oh my God, I'm going to have to follow exactly what the doctor says. Do you ever feel like you're the experimental rat that's in the jar and they're doing whatever? Well, again, did I say that? Yeah, again, my opinion. I don't mean to tell you that everything is always, because nothing is always. But this coming Wednesday night, we're going to be talking about the identification of cancer, breast tissue cancer, and other cancers and other diagnostic modes through a non-invasive process called thermographic imaging. So make sure you join us. And I'm going to let you know how you do that here in a second. make sure you join us, because Derreth Painter is going to be the presenter. I'll be there with her talking about some of the other pieces, and it keeps her out of trouble. And I'll give you my opinion on the stuff, but she's going to tell you thermographic imaging does not diagnose cancer, but it diagnoses the blood supply through heat observation of different things forming the system that normally would not be there, or would be a normal thermal reading, heat reading, or a cool area. But when it gets hot, and it does it in consolidation, and it's very specific in pinpointing, all of a sudden you have evidence that says, got a problem, and you better check it out. You better see what the deal is. Get in and start really doing your homework. Remember my book, Ageless Health? Health is a do-it-yourself program. I did that about 12 years ago now. And the reason I did that book is to empower you to understand what it is that you need to do to protect yourself by asking the correct questions, the right questions. If you have enough information and you understand it, and it's not hard. If you break this stuff down into bite-sized pieces and show people where it comes from, you get to understand. When I sit there and I do different types of blood work with patients, I sit with them and I break it down so they understand it. For example, something as simple as this. You do a blood count. So you have CBC, complete blood count. And we look at the amount of the red blood cells, the white blood cells, the subfractions of the white cells, and the sizes of the red blood cells and the amount of iron that's available and so forth. So I take things like MCV, right? And I say, your MCV is this. And if you go in your doc, your MCV is this. It tells me this. So what I do is I tell them what MCV is. It's the volume, like looking at a pancake, the big circle of a pancake. It's the volume of the red blood cells, the width of it. It's the diameter of it. And I said, if that number is large, the diameter of that blood cell is big. And it has to fall within certain functional medicine. If the diameter is really small, then it tells you that they're new cells. They're being made properly, and the B12 level could be involved as well. Then there's something called RDW. And I explain what that is. And it's like if this is the diameter, then this is the thickness of it. And I relate all those pieces to them so they understand it and what it means about the oxygen transport and iron and so forth. So you really get it. But why do that? So you go back and ask your doctor some questions that are very, very specific relative to, what's going on with your blood work. And I go through all the way with the blood fats and tell them what they mean and why they're there and ask some other questions. But with this is more important in many cases for some of you. You need to understand what the vernacular is. You need to understand what the different tags that these guys are throwing at you. What do they mean? So you get something like H2ER, so forth. HER2, positive breast cancer, is a breast cancer that tests for a protein. And that protein is called a human epidermal, that has to do with the outside of a tissue, epi, outside, dermal, skin, growth factor receptor 2. Now that's a big mouthful, but there's a way of breaking it down very easily. And then, you go into and you say, okay, what does that really do? Well, it prompts the cancer cell to go crazy, to grow, and it prompts it to metastasize. So if you have an HER2 positive cancer, it means you got a problem there. But does it mean that you're going to die? No. But can you detect the potential, the possibility, if you will? And the idea is, yes, you can with thermographic imaging, because these guys are going to increase the heat signal and the blood supply. So when we talk about, again, we'll go because it's common out there, the vocabulary is there all the time, the HER2 proteins, and again, we call receptors, they're on all breast cell surfaces. So the HER2 protein manage breast cell growth and repair. So they make sure that the cells divide as they're needed to replace damaged or dying cells, right? So if that's the case, where does it get crazy? So again, it affects the breast cancer and of people particularly that has, if it gets out of range, invasive breast cancer. That means it goes into the tissue and has a greater risk of metastasis. So if an HER2 positive breast cancer, this protein that manages how cells grow and divide is kind of finger pointed to initially before it has the ability to allow things to go crazy. Wouldn't it be great to be able to know that? So invasive, what they call invasive ductal, ductal means a tube, just like it sounds, of cancer, between 15 and 20% of those breast cancers will be HER2 positive. And men and, they say men who have, I hate this stuff, you're going to get me started on it, and I probably shouldn't go there, but I'm just going to say that men and people who are assigned at birth as male, okay, assigned at birth. Do you know that there's an actual terminology for that now? AMAB? Yeah, don't get me started. They rarely develop HER2 positive breast cancer. So ladies, you got more of it, but guys, you're still going to get the breast cancer from the high levels of estrogen tags. So what are the symptoms if you have an HER2 positive breast cancer? Well, the change in size, the color of your breast tissue, you're going to get these little pickling, if you will, this puckering that occurs. You're going to get a change in the contour of your breast. You're going to have a lump that's going to be there that seems to be stuck, if you will. It's not freely movable. You could have a lump or a thickening underneath your breast or underneath your arm, if it's gone into the lymphatic system. But that lump persists beyond your cycle, beyond your menstrual cycle. And so that puckering, that dimpling, you could have scaling, you could have an inflammatory level, you could have this marble-like thing in there, you could have blood or discharge that comes from your nipple. Guys, same thing, by the way. So you've got to understand what the finger pointing is and not ignore it. Not ignore it. So, you have BRCA markers that are, could be a genetic mutation and an inherited pattern. Is that a problem necessarily? Not necessarily. Just because you have a predisposition genetically doesn't mean you need to go have your breast chopped off. There's a stomach cancer that is a familial genetic stomach cancer that if it's detected, at that point it's too late. You have a very, very low level of survival on it. So there's people out there that go out and have their stomachs removed, preventatively, when they found out they have that. And I don't know about you, but it doesn't seem to be the best cycle to me, knowing that genes can be suppressed and good genes can be put on top of it. What you think is the problem? So listen, if you have this genetic predisposition, the genetic mutations, if you have a history of breast cancers in your family, if you have a condition of ductal hyperplasia, meaning swelling, irritation, if your menstrual cycles started really, really early than usual, if you started menopause later than usual, if you're taking a hormone replacement, if you're drinking more than a drink of alcohol every day, if you had a history of, remember I've talked about it over time, radiation therapy, guess what? It may be really good to incorporate a non-injurious way of detection, at least finger pointing, that we really have a problem here. That's called what? Thermographic imaging. And we're going to talk about that this Wednesday evening, the 11th of the month. And I want you to get online. I want you to go to rosellecare.com and register. You go to drtomroselle.com and register there as well. But get it done. Do the registration. Let's make this happen. And I promise you, Derreth is going to show you things that you didn't know about. And you want to make sure that you have the right questions, the right tools based on understanding that you can ask your doctor. So tell me about this. And if they can't answer the question, then they can't give you the right information relative to what's really going on. And remember, false positives and false negatives, they're critical, they're important. And, when they talk about medical treatment, it's really important that you understand that they're talking about, at best case scenarios, monoclonal antibodies. They're using a lot of those today. But also they're talking about radiation. They're talking about biopsies. They're talking about breast amputations. They're talking about those kind of things. And, they're going to say chemotherapy to shrink the tumor before they do surgery. Now you got a double whammy. Is that necessarily a good thing? I have an opinion. You probably can extract my brain thought right now, but listen, you have to look at the potentials. Are you overweight? Are you a skinny fat person? There's that other piece that they don't talk about because you're going to have an increased risk. Is your cortisol level too high? That's going to produce something called aromatase. Aromatase is an estrogen-like situation. That little soft weight that you have around your belly that just never wants to go away no matter what you do, that's cortisol weight. That cortisol weight will cause aromatase levels to be, it's an indicator that the aromatase levels are higher than normal. And so you really got to look at this whole thing from multiple levels of understanding, if you will, and then take the control of your body and make decisions based on information. Listen, most of these guys out there, they are giving you the best that they know, but the best that they know is based on just the clinical observations that they're trying to call research. But we want to make sure that you give yourself every opportunity to prevent cancers. We're seeing cancers today exponentially higher than they were 20, 30, 40 years ago. And with COVID, these turbo cancers that are showing up all over the place, the breast cancers are through the ceiling. By the way, did you know there are antiparasitics that will resolve cancers? Derreth may talk to you a little bit about that this Wednesday evening, as well as some of the other things. But you got to get your body supported. You have to turn things around. You have to make things much more stable, if you will. But it'll be this Wednesday at the 11th. And tell all your friends to, listen to these programs. You can find them at drtomroselle.com. And if you get into that site, you look up to the upper right side of the bar, and it'll say radio programs, and it'll say the Ageless Health live stream, and there's tons of data there for you. I want you to take the opportunity to really look at this. But join us this Wednesday evening on the 11th. I'll be there. And, I'm going to let Derreth have her head in the lead, and I'll be the guy that'll be throwing my 2 cents in, so it doesn't come from her. But we're going to give you enough information to be able to understand that you have to have the data to rule things in or rule things out, and not just necessarily accept, the current thought process. Because, I heard a physician say one point, maybe 20 years from now, we're going to realize that we were wrong. We actually caused a lot of problems for patients. So if that's the case, wouldn't it be nice now to have information so you can, not only ask the right questions, but make the decisions accordingly? Because I'll tell you what, sometimes if you're unencumbered by all the thought process that I think is spurious, in my opinion, that you can make a better decision for yourself. But unfortunately, in this situation, we're talking about cancers across the board. It's ruled by fear. And if you have information, you become less fearful. So join us coming up in a couple of days at the Roselle Center for Healing in Fairfax. Love to see you there and love to answer your questions. And I'll tell you whether it's my opinion or it's something that you can really run on. And I promise you're going to see before and after images on thermographic imaging that are cool. Thanks for joining me. And remember, I do this on an ongoing weekly basis. Simply one reason. I love you all. Have a great Sunday. Take care of yourself.
Breast cancer is a major health risk to all women. It can silently grow uninterrupted for years. The Thermography Centers of Fairfax reminds all women to conduct monthly and annual breast exams. Consider a thermography scan from the Thermography Centers as an adjunct to your routine breast exams. Digital infrared thermal imaging is safe and non-invasive. For more information and to schedule an appointment, call 703-520-7591 or visit thermographycenters.com.
Neuromuscular dentistry is more than just teeth and gums. Temporomandibular joint disorder is a very painful disorder, which only a skilled neuromuscular dentist can diagnose and treat. If you're in pain and suffering from TMJ, call the neuromuscular dentistry experts at Soft Touch Dental Care. Learn more about TMJ and how Dr. Michael Chung DDS has successfully treated patients. Visit softtouchdentalcare.com or call 703-319-6990.
Are you dental phobic? Do you neglect your dental health because of fear and anxiety? A beautiful smile begins with exceptional dental care, and you can trust in the expertise of Soft Touch Dental Care and Dr. Michael Chung. Soft Touch Dental Care is unlike any dentist office you'll ever experience. Their warm and welcoming environment is designed to soothe fears and anxiety the moment you arrive, and they're especially pleased to pamper their honored guest patients. Dr. Michael Chung is a professional and leading expert in all areas of comprehensive dentistry, including cosmetic, sedation, neuromuscular, TMJ, and implant dentistry. Offering state-of-the-art technology, Dr. Chung can give you the smile of your dreams. Arrange for a complimentary consultation today with Dr. Michael Chung and experience the expertise that makes Dr. Michael Chung so unique. Call 703-319-6990. That's 703-319-6990. Or visit bestinsmile.com. That's bestinsmile.com.